Thanks for listening to the Granite List Live. Today's episode is brought to you by Connect Healthcare Collaboration, where benefits marketing meets clinical advocacy to drive effective employee engagement. Welcome to the Granite List Live. I'm your host, Sally Pace, and today I am really excited about this episode. I am joined by Dr. Erica Barnell, who is the co-founder of Geneoscopy, and Lauren Robertson, who's head of clinical advocacy for Connect Healthcare Collaboration. Ladies, I think today's show is going to be so insightful, as well as sharing a really innovative solution that is coming into the marketplace. Erica, I know you have created something that you've brought to market that is incredibly interesting, especially to folks in my age group. I'm on the 50 plus crowd, but it's certainly a solution that can be used by many more than just that 50 plus age crowd. So tell us a little bit about what Geneoscopy is, what products you've created, and the journey that led you here.
Absolutely. So I always refer to Geneoscopy and our lead assay, Colosense, as kind of my first baby. I founded the company when I was a first-year medical student based off of research I had been conducting in the microbiome labs at WashU in conjunction with some of the individuals I was seeing in the clinic. I was encountering young moms who were presenting to the hospital with late-stage colorectal cancer. I was meeting patients who had debilitating IBD and were going months, if not years, from getting a diagnosis and effectively being treated. And so that culminated in founding Geneoscopy in 2015, where the premise was to leverage RNA-based biomarkers to better monitor, diagnose, and treat gastrointestinal disease.
And since then, I know, there has been this, I guess, let me think how I want to say this.
Yeah, I think I'd say, traditionally, colonoscopy has been the way in which we screen for colon cancer. There are several non-invasive tests on the market. And I think that despite the fact that we've had colonoscopy since the 70s, FIT more recently, and other non-invasive approaches since then, the fact still remains that colorectal cancer is the second leading cause of cancer-related deaths. The fact remains that 40% of patients are non-compliant with colorectal cancer screening. The fact remains that incidence in younger patients is on the rise. We're seeing people that you wouldn't expect to be getting colorectal cancer, celebrities, individuals with exceptional health care, below the recommended screening age, again, presenting with late-stage disease. And so as we start to think about how can we address this public health problem that's impacting, hundreds and tens of thousands of lives, what can we be doing as a diagnostic company? And so that was the impetus for developing Colosense, which is our lead assay. It's an FDA-approved stool-based cancer screening test that leverages RNA biomarkers in stool samples to diagnose and screen for colorectal cancer and precancerous lesions.
And you mentioned that this is colonoscopies have been around for a really long time. So was there a particular aha moment that led you to this?
Yeah, I think I, like you, look in the mirror and I start to think about, my longevity and my healthcare, and first, fourth, fifth, sixth, seventh, 10,000th thing on my priority list is, taking care of so many other things, whether it's work or personal or, my kids, my dog. And the last thing I'm really thinking about is colon cancer preventative screening. And so what we did was try to develop a test that really integrates into people's lives, a test that's highly sensitive for younger patients by leveraging RNA-based markers that are not correlated with age-related processes, so they can have high accuracy in younger patients, and develop a test that's really easy to use. So with Colosense, if you get a prescription, the test comes to your home, you go to the bathroom whenever the time comes, and then you use the same collection kit to drop ship it back in a FedEx box and send it back to our laboratory. It's simple, it's easy, it's touchless, there's no scraping involved. And so we've really tried to make it as simple for patients as possible and integrate it into their lives so they can feel confident that they're doing right as it relates to preventative screening and making sure that they're getting up to those other high priority things that we all know and are very accustomed to.
You touched on, people oftentimes don't make time for preventive screenings. And Lauren, I know that is the world that you deal with day in and day out. Before we talk about what you see on the employer front, I'd love for you, if you're comfortable, share with the audience, Lauren, a little bit about why colon screenings are so personal or hold a personal space to you and kind of how it became part of your career journey.
Yeah, you bet, Sally. So I am a nurse practitioner by profession. And so what Sally is alluding to is a journey that led me to the company of working with Connect Healthcare, which ultimately led me to meeting Erica on this call today with ColaSense. And so I practiced in primary care, internal medicine. And while I was in practice, what happened is my father became terminally ill, actually with colon cancer. And so just a little bit of information about his screening journey. He had had a screening 8 years prior that was quote unquote normal, no polyps, nothing that looked suspicious at his colonoscopy at the age of 50. And so what happened is he turned 57 and began to develop symptoms, strange bowel habits, things that men usually aren't comfortable talking about and will postpone it and relate it to, I've traveled a lot, my diet was off, all the things that you want to say, and a need for it not to be something wrong. Ultimately, he ended up getting diagnosed with colon cancer. And then that actually led me to transitioning my career at that point after having lost my father. A big part of my goal and my journey as a healthcare provider is to make sure that people understand the importance of a screen, understand what that time limit should be for you, you understanding your risks, you understanding if you're above the risk of average person and what you should do about it. And ultimately got led into Connect Healthcare, where my journey is now helping employees on the health plan be navigated to those benefits that your company is covering, oftentimes preventative. There be no out-of-pocket cost to you. And then got introduced to ColaSense, which gives people a great way to take care of a screening without having to take a complete day off work, find transportation, have to do a prep the night before. If anybody on this call is listening and they've done the colon prep, we all know it's a 24-hour ordeal. So if you're an average risk individual and you're young, it's like a great alternative for you because it gives you an opportunity not to think about bad things, but, like my father, like James Vanderbeek, if you're a Dawson's Creek fan, he was far below the average age. And then now he's looking at a stage, a late stage colon cancer. And so this gives people a great look into a window of taking care of a prevention screening at younger ages and then making sure that you're taking care of yourself with little to no disruption in your day. So that's kind of what led me here, and I was thankful to hear about ColaSense.
So you're on the front lines talking to plan members, spouses, dependents directly. Erica outlined some of the reasons why people don't. Do you have any other insights into what causes people to not take that ounce of prevention, what you're seeing and what you're hearing?
Yeah, it's always a couple of things. One of them is the disruption of the test itself, like having to find somebody to take them, the prep before, having to be put under anesthesia. So the disruption in their day is often a contributor. And oftentimes people will say, I don't want to have to pay for it. Like I'm going to have to pay my deductible or reach my out-of-pocket maximum. And I don't have, X amount of money to commit to a prevention screening when oftentimes those are covered 100% by your plan anyway. So those are the two biggest caveats I think I hear when people are pushing back on getting a prevention screen.
And Erica, from the opposite side of the fence, why does this matter? Why is it so important? Specifically, colorectal cancer screenings, why are they critical? And then what are the limitations of existing screening options?
Yeah, and I'd say, Lauren, thank you so much for sharing your story. I'm so sorry to hear that. And I think it's a story that resonates with a lot of people. A lot of people have lost loved ones to this disease that I refer to as the most preventable but least prevented cancer that we have, right? Your father did everything right. He got his colonoscopy at 50 and it was negative. But what we know is that colon cancer can develop in the course of 10 years. And I think that's why these non-invasive options where patients don't have to take a day off work, they don't have to spend 24 hours in the bathroom, they can just poop and ship. It's a way to integrate into your day, into your life that is not very disruptive. And those tests, those non-invasive tests, can be completed on an interval that's much shorter so that those interval cancers that are developing, especially for patients that are otherwise healthy and young and viable, those individuals can get to colonoscopy more quickly and be elevated to a higher risk patient population and not be thinking necessarily about, am I going to spend my entire deductible on one colonoscopy, as opposed to using a really less expensive non-invasive test.
And I am clearly the least intelligent person on this call, especially when it comes to some of the terms I'm going to ask you to throw out, Erica. Will you tell in simple terms for our audience how ColoSense works and what makes it different than other stool-based tests that are on the market already?
Absolutely. ColoSense is patient directed. It was developed by physicians for patients. So I think there's three components that make it ease of use and accuracy straightforward and aligned with patient and provider needs. The first is the collection process. So as I mentioned, it's as easy as having a cup of coffee in the morning and go into the bathroom. You put a little collection device on your toilet, you deposit a sample, and then we provide a prepaid shipping label that, again, you can just chunk the kit in a FedEx drop box. You never talk to anybody, and it comes right to our laboratory. We generate a test result and then provide that result back to the patient and the provider. Individuals that don't have a disease, don't have colorectal cancer or precancerous lesions, our negative predictive value is 99.96%. So you can be pretty confident that if that test is negative, that you don't have a cancer. And then what's important is for the patients that do have a positive ColoSense test, the recommendation would be that those individuals go on and receive a colonoscopy. So we provide navigation services and wraparound services to ensure that patients are scheduling a colonoscopy within network, within geographical location, and hopefully at a center that has a lower cost burden for patients to make sure that they're getting that follow-on care, having precancerous lesions removed or cancers at early stage removed before they develop into a late stage malignancy. One of the biggest benefits of our tests I mentioned is that we leverage RNA-based biomarkers. This is the only RNA-based test that is FDA approved for colorectal cancer screening. What's important about that is that RNA biomarkers are not correlated with age, as opposed to methylation-based biomarkers, where as you age, your genome tends to methylate. So sensitivity is higher in older patients and lower in younger patients. Because we're using RNA biomarkers, we're maintaining accuracy in that younger patient population. So as we start seeing a higher incidence of disease in patients under 50, under 45, under 40, and as the recommended age for screening continues to drop based on that increase in incidence, we feel confident that our approach, that ColoSense, is accurate in that younger patient population.
And Lauren, going back to the patient population, what advice do you have for the employers that are listening as far as how to better engage the population in prevention?
That's a great question, Sally. And so I think what happens is people need to hear a message a number of times. So what we do is we utilize our clinical advocacy team to take data and tell us about how population is performing, how their health looks. Are they missing important screenings that they should be taking care of within their age range, within their risk factors based on ethnicity and things of that nature? And so I feel like what's really important is utilizing trends, utilizing data, letting you know what's happening within your group, and then using outreach strategies to get to those individuals. Did you know that screenings are important? Did you know that these factors put you at a higher risk? Did you know that this is how often this should be done? And did you know that your plan covers this at 100% for prevention? And so a lot of times planting those seeds allows people to own that decision. They say, oh, wow, I actually am in that age range. Oh, wow, I actually haven't done that. And I didn't understand those risks, nor did I understand this would be zero out-of-pocket costs for me. So I think planting the seeds and understanding your population is important. And it's good to have a trusted source and a mouthpiece to do it and to help.
I think the work that Lauren is doing to educate patients is such a huge unmet need. There's so many individuals who say, oh, I didn't know that I didn't have to pay for this. Oh, I didn't know that the screening age for colon cancer screening is now 45. I've been told it was 50 my whole life. I was going to wait until I was 50. And I think that is the first step to put patients in that contemplation cycle where they start thinking about, okay, I'm at risk. What do I do next? And I think that's where our team comes in, and we can kind of drop ship the collection to the patient, right? And send them a cup of coffee and be like, do your thing, girl. and then once it gets back and there is a positive, again, holding the patient's hand and saying, look, that test was positive. Where can I schedule you a colonoscopy? Are you interested? What are the barriers to getting that piece done? Are you afraid of the prep? Do you need a specific provider? Just hand holding the patients and navigating them through the world of healthcare, which we all know is incredibly complicated and sometimes scary.
Absolutely. And Erica, you've explained the efficacy, what makes ColoSense superior in the marketplace, but we don't have to just take your word for it. I know you all have recently reached FDA approval, and that is a huge milestone. So congratulations. And can we end the show kind of talking about the future of colon screening and kind of where you see your team, your company going?
Yes, we received FDA approval for colorectal cancer screening. We demonstrated a 93% sensitivity for colorectal cancer and 46% sensitivity for advanced adenomas at an 88% specificity for no findings on a colonoscopy. And so we did receive first line approval from the FDA. We were recently mentioned in the NCCN guidelines with review by the American Cancer Society guidelines this fall. And recently CMS just opened an NCD to evaluate our tests for coverage within the Medicaid and Medicare population as well. So we have a lot of momentum on the colorectal cancer screening front. I will say, as a scientist, my heart and my roots lie within inflammatory bowel disease and inflammation. And so while we're still continuing to develop and iterate on our ColoSense franchise, we're also going to be launching our IBD assay in 2026. So that's coming. Another big unmet need that I feel can be addressed is in predicting therapeutic response and monitoring mucosal healing for patients with IBD. I think that's another disease where young patients are spending days, if not weeks, in the hospital, months, if not years, in flare. And so being able to provide precision medicine approaches to subjects with IBD to prevent them from flaring and ensure that the induction therapies are efficacious is going to be our next big effort in the GI space.
Well, you know that we'll have to gather back here again once that becomes a thing. So more to come for sure on that front. But I know we have had a fabulous discussion today about ColoSense. So excited that you have brought this incredible product into the market. And we'll drop the different links for the website, LinkedIn, Twitter into the show notes. But absolutely, please visit geneoscopy.com and reach out to Erica. I know that there is a place on the site, not that it's going directly to Erica, but to the team. But really, this is something that employers are starting to take more note of, this whole again, that ounce of prevention, the importance of prevention. And I know that throughout the Granite List community, we're seeing a huge surge in solutions that help with prevention. And so we are so excited to be able to bring ColoSense into our community as well. Thank you, ladies, both for joining the show today. And thank you to our listeners for tuning in to another episode of The Granite List Live.
Thank you for listening to this episode of The Granite List Live. Access our entire library by visiting your favorite podcast venue or subscribe on our site, thegranitelist.live.